Hello everyone, my name is Lizette Galvan and today I'll be doing my presentation on depression. What is depression? Depression, which is also known as major depressive disorder, is a very common yet very serious medical illness that negatively affects the way you think, how you act, and how you feel. Depression causes feelings of sadness and or loss of interest in activities that you once enjoyed. Who can get depression? Depression can happen to anyone at any age, child or adult, and happen to people of any ethnic group or of any race. Fortunately, it is treatable. Women suffer from depression twice as often as men due to different factors such as premenstrual dysphoric disorder, which is not PMS. PMDD is a serious disorder which causes symptoms such as anger, depression, and irritability. Perinatal depression, which is also known as postpartum depression, which is depression during or after giving birth, much more serious than the common baby blues. Perimenopausal depression, which is the transition into menopause, which can sometimes be difficult, causing depression. Depression affects approximately 17.3 million American adults, which is about 7.1% of the U.S. population aged 18 or older in just 1 year. What causes depression? It's not known what exactly causes depression, but several factors often link to the development of depression. Some factors include family history, which means depression can run sometimes genetically. However, if you have a parent or a close relative with depression, that doesn't mean you'll automatically have the same experience. Personality. Sometimes people may be more at risk of depression just because of the personality. If they tend to worry a lot, have low self-esteem, are perfectionists, and are sensitive to personal criticism, or are self-critical and negative. Drug and alcohol use, serious medical issues, but there are different treatments. There's prescribed medicine. You can get antidepressants, and antidepressants might be prescribed to help modify one's brain chemistry. Electroconvulsive therapy. This is done in cases where medication or psychotherapy isn't working. So this is more on the serious note. Symptoms include feelings of sadness, tearfulness, emptiness, and hopelessness. You may experience angry outbursts, being irritated most of the time, frustrated. You may experience a loss of interest, and you may be having troubles with your sleep. Depression rates in the United States and worldwide are unfortunately increasing. Many studies have found that being divorced, separated, or widowed is closely linked to depression. On the depression statistic website, there were some examples. Married women are more likely to be depressed than unmarried women. Married men are less likely to be depressed than unmarried men. Unhappily married women are 3 times more likely to be depressed than unhappily married men. In 2015, an estimated 16.1 million adults aged 18 or older in the United States had at least one major depressive episode in the past year. On this chart to the left, you can see in the 12-month prevalence the major depressive episodes among the U.S. adults. African Americans have a lower lifetime risk of depression than whites. Depression can't actually be prevented, but there are different ways to keep depression from coming back. You can find ways to handle stress and improve your self-esteem, such as doing yoga, meditation, joining a club, and doing things to keep you involved. You can reach out to your family and friends when you're feeling down. You should do things that keep you connected to others. You should take good care of yourself, get enough sleep, eat well, and exercise regularly. As stated in the National Sleep Foundation, the link between sleep and mood has been seen over and over by researchers and doctors. People with insomnia have greater levels of depression and anxiety than those who sleep normally. You should seek medical attention if you feel that your symptoms are worsening or if you are feeling suicidal. Talk to your therapist or doctor about medicine that can stop your depression from coming back. You should avoid alcohol and recreational Drugs. It may seem that these things make you feel better, but they can make it harder to treat your depression. If you or anyone you know are feeling down or just need someone to talk to, I attached different free hotline numbers that you can go ahead and call and talk to a trained specialist and get the help you need. Don't be afraid to get the help you need. Depression is more common than you expect. Here are my online references, and that concludes my presentation.